This is the CMU EDUcast, all about issues and new ideas in education in Thailand. I'm Mangum. This week, promoting mental health in schools. The classroom is often the front line when it comes to recognizing and responding to the real mental health issues that teenagers and young kids can experience. How can we prepare teachers to be first responders? And what would that look like in the context of a Thai classroom? Joining us this week is Aj.Nanthaka Fuseekul, Lecturer of Educational Psychology at Chiang Mai University's Faculty of Education. Thank you so much for taking the time to join us today.
Yeah, my pleasure. And thanks you so much for having me today.
Where are you?
Now I'm in the UK. So now I'm studying a PhD in psychology at the University of Reading. And I'm writing up at the moment, and hopefully I will finish the PhD soon.
So you're finishing a PhD, your doctorate in educational psychology at the University of Reading. Is that...
Actually, it's quite a little bit tricky because I will finish the clinical psychology in my PhD.
It's also clinical psychology as well as educational psychology?
So let me talk about my background first. So I have a bachelor degree in clinical psychology and my master in educational psychology. So when I try to apply for the PhD, I look for the course that quite related with clinical psychology that can put into practice in school, because now the mental health topic is quite I'm not using the word popular, but it's quite a big concern in school. So I would like to apply some of the psychological theories and concepts to put into school.
So you're a person who's making a bridge between clinical psychology and educational psychology, and specifically in Thailand. Why is this an important bridge to make?
Actually, it's quite interesting that when I first come to the UK, I know nothing about the mental health in young people. And because when I come here, in our department, we have like a research clinic that we work with young people in particular. And we're focusing on do research in depression and anxiety in young people. So at first, I know nothing about this. But when I go to the clinic and I have learned how to provide the information or provide the assessment to students, and lots of my colleagues, they are working at school as well. So I think this kind of thing is quite very important because the research about mental health in young people in Thailand is quite small and it's quite limited. People not pay attention much in the mental health in young people. So I think it would be good that if I get back to Thailand and I can bring this kind of stuff back to Thailand as well, and then we can help to develop the project or the program that can promote and preventing mental health in school.
Wow. So you're really bringing back with you a really important service for students and for young people in general. Something that is available to young people in other parts of the world and is now finding its way to Thailand because of you. And are you aware of other people in this field who are in the process of bringing mental public health to schools in Thailand?
I think because this is quite a big and a huge project. So yeah, of course, I need to have a team that when I get back, I need to form a team like a mental health professionals or lecturer or who are expertise in psychology to work with me to build some of the community that we can provide the information to school, to teachers, to students, and also parents. That's to make sure that we have more power to, disseminate this information to our communities. Because as you know that in Thailand, we have like the stigmatized in Thailand is quite very high among people when we see a mental health illnesses person or people. So I think the mental health literacy or mental health knowledge and education is a key. Sometimes in the area or in the culture, that stigma is quite high because people don't have information and the lack of knowledge about that, and they don't understand people who have mental health illnesses. And I think this is very important because it can cause the barrier to seeking help. Yeah. So I think most of Thai people, they try to avoid to seek help because they don't want to be stigmatizing, and also they don't want to embarrass themselves because they think that some kind of mental health problems this might see as the abnormal person, kind of that.
Or maybe a weakness. Maybe mental health is a sign that you're weak, or that sometimes there's a religious explanation. I've heard of people talk about ghosts and bad luck.
Yeah, especially with Thai culture that we still have some roots of the belief that we still have that thought that people with mental health illness, because they might have some of karma from the past life, or maybe we did bad thing in the past and it's as consequent from the past life, rather than focusing on scientists that it's just only the imbalance in chemical, and it can caused by other psychological events, or
Sometimes that gets in the way of actually giving people help that they need. So that's really great that somebody is trying to tackle this problem. One of the things that has happened in a positive sense in terms of how attitudes towards mental health and understanding of mental health has changed in the West is the way that it's dealt with and portrayed in popular culture, in popular media. Has there been any progress in the way that media in Thai popular culture approaches this issue and especially addresses it for kids?
Yeah, I think now there are more people, they pay attention more on the taking care of themselves about the mental health, because we have the social media like Facebook, Twitter, or like at YouTube, that many mental health professionals like psychiatrists or psychologists, that they have like their own Facebook fan page that provide information that quite necessary to parents or children or teachers to provide an appropriate way to help their own children. So I think now the trend is quite impressive for me, because I've been away from Thailand for 3 years, and before I came here, nothing happened. But after 3 years, because I'm still on Facebook and I follow the fan page of the many professional, and they seem quite, try to encourage people to take care of their mental health. And I think it helps community in the terms of people, they try to understand more about themselves, and also can recognize some of the symptoms, that they can notice that what happened to them, and then they know something happened to them and this is unusual. They maybe, search for more information by themselves. I think this is the good start for taking care of themselves, and it can reduce the severity of symptoms. And also, this is not just only by themselves, but they can recognize the symptom from people who are around them, like family, friends, or other people that they're surrounded with. Yes.
Proportion-wise, when people are identified as having a mental health issue, how much of that comes from the individual themselves? How much of that comes from other people, like their family members, people in their community?
So I will answer by my experience. So I have talked with children and adolescents for a very long time. I think the person who is know much about, can notice about the symptoms, is children themselves. Because sometimes parents can't notice of the behavioral changes or any other kind of symptom that they can recognize. And sometimes when I interview both children and parents kind of don't know what's going on in their child. So it's quite interesting that when we compare the answer between children and parents, is quite not, overlap sometimes. So I think right now, children and adolescents, they tend to, look for the information by themselves, and because they have friends and they will discuss this together, and they might see that, because they're quite close friends and they spend much time in school. So that's why they can notice each other. But in the opposite way, nowadays, parents quite spend less time with children because of maybe they busy at work, or sometimes they just don't have much time to spend with their children. So sometimes they might miss some of the symptoms that can relate it to mental health issues. So from my experience, I would say that children they can recognize their symptom and they can know that something happened to them, but sometimes they just don't say it. Sometimes they just want to keep it themselves because they just don't want to disturb their parents, or maybe they just don't want to other people see them as like an unusual person.
Is it the nature of many mental illnesses that they don't want to reveal themselves, that a person with depression doesn't have the energy to get help, or a person with anxiety is too anxious to get help, or a person who is experiencing a big change in the way that they're perceiving things may be too afraid to get help? It seems like the nature of mental health issues, actually part of the nature is ironically to prevent getting help. Is that true, or is that... I have no idea.
Okay, so I think it just, maybe if we talk about the culture, maybe we need to think about the characteristic of Thai young people that is quite different from the children from the West, because they try to inhibit their feeling and their emotion. It's quite interesting when I'm asking the question that, how are you feeling? And they can't say that how they feel right now, because they don't know that what are the experience right now, what is called. Because sometimes when I ask them about how are you feeling, they might answer the question is about their thinking instead. So I think the characteristic of Thai young people might be that can relate it with mental health illnesses, because they don't want to disturb other people. They're more polite, and they think that their problem they need to solve by themselves. And sometimes asking for help, it's just like we disturb other people. I think right now there are many children that they try to help themselves by asking for help, by behave to get attention from someone that, yes, I need help. But it's quite easy to, recognize those of children. But there are lots of children as well that they try to keep it by themselves. And it's quite hard to notice in the classroom, because lots of depressed young people, sometimes they just don't show any symptoms to anyone. They try to be smile and to be like a good kid and good behavior, unless teachers can notice a specific behavior, like they withdraw from social activities, or maybe they eat less and they seem tired almost all the time. Because of it's like an internalizing disorder that is quite hard to see in public. But for the externalizing behavior, like aggressive behavior or, like an impulsive behavior, it's quite easy to recognize that, this child, they might have some problems. So we can see this easily.
What are some of the major mental health issues that kids face in Thailand, but also in the world? What are the big ones?
So I think the big one could be depression at the moment, because I'm working in the clinic with children who have depression, and it's quite a big concern in the UK as well. And I think it's quite a serious public health across the world, because I know that the prevalence of major depressive disorder among young people across the world is 2.6% across the world. It might not as high as adult, but because it's increased every year, and it should be the thing that we should concern about it, because we see the consequence of depression that can affect of children functioning in their daily life. And also depression is a risk factor to suicidal behavior as well. So we can't deny this is not the real thing, or this is not important. But I think we should think about in the way that how that we can prevent this to happen to our kids or to our young people in our country, rather than focusing on what is the highest or the lowest mental disorder in the world. Because every mental health disorder should be treated and should be recognized and should be, treated in appropriate way.
Going back to the idea that depression is a precursor for suicide, are suicide rates any different in Thailand than they are in the rest of the world for young people? Is there a difference in what we're seeing?
I think the rate of suicidal in Thailand is lower than other countries, like it's comparing with the high income countries. But the big important thing that we have challenged now is just only we don't have enough mental health professionals who working on this kind of research in children and adolescents in particular. And we don't have the policy in school that prevent and promote mental health in school to reduce the incidence or severity of this kind of problems. Yet, I think we should have that. But I think in many countries, like in the UK, they have like health and safeguard for policy in every school that they might have the mental health staff that can work with children in particular and to see if they need any other risk factor that can cause the severity of mental health. But in Thailand, when I work with school and I said, if some student, they express some of the symptoms of depression and they try to, commit suicide, what school does, and school can't answer that kind of question. They said, just ask for the psychiatrist or maybe just ask for help for the external hospitals.
So schools really are not trained, they're not ready to handle some of these problems. And I'd say that's probably true around the world. It's not just true in Thailand. Another school-related mental health issue that is also kind of connected with suicide and depression is one that's received a lot of attention in the last 10 years is bullying. And I know that in the U.S., there's been a major effort to raise awareness around bullying. And now there are new ways to be a bully. You can be a bully in person, like the old-fashioned way, and people can be bullied online, too.
Yeah.
Yeah. Do you have any insight into bullying as a mental health issue in schools?
Bullying, it can cause and related with many mental health issues like anxiety or depression and can cause a severity of the symptom of mental health illnesses as well. Because most students that they have been bullied, they quite, trauma from the situation or the thing that happened to them, and they try to avoid to go to school, or sometimes they don't know how to cope with their situations. Sometimes it's turned to other behavior, like a misbehaved behavior, and also they might have a high risk of using alcohol, substance misuse, or maybe they turn to be a victim into the bullier to bully other people. So the situation is like a circle. It's like a vicious circle that we can't stop that to happen. So I think the thing that we should do is just prevent that to happen in the first place. So I think teacher is in a good place to notice that behavior and to try to promote the good environment and safe environment in school. I think that is very important.
So, yeah, it would seem that schools are the usual place where bullying happens because that's where kids are together. That's where they socialize. Mm-hmm. They spend most of their time at schools. So things like bullying often take place in the classroom or on the playground or at school in some way.
Yes. And the reason that why sometimes teacher not take any action on the behavior that they bully to each other, because sometimes teacher don't know how to deal with it because they lack of knowledge how to deal with the situation that students like a fight for each other or try to mocking with each other. They just say, stop, don't do that. But it doesn't help. You know what I mean?
It's like telling someone not to be nervous.
Yeah.
Like, it doesn't help, right?
Not at all. Yeah,
it's
that's
like,
right. Mm-hmm.
Yeah. So don't be a bully. It's like, well, okay.
Mm-hmm. Yeah, I think instead of telling that I'll stop doing that, or maybe sometimes they bring the kids who bully each other to say sorry and say thank you, but it's not enough because it's just only I don't know what it called in English, but it's just like
only done for show, only done to perform for the adults. We'd say a Latin word would say it's pro forma. It's just to do it to get it done with. And then they'll go right back to the bullying.
Yeah, that's right. But we didn't go to the root of the problem, what happened. But because this kind of thing takes time for teacher. Because the teacher in Thailand is one of the career that have heavy workload. So apart from document things or teaching things, maybe teachers are quite tired from maybe other problems that they need to deal with in the school day.
Join us next week for the continuation of our conversation with Aj.Nanthaka Fuseekul, lecturer of educational psychology at Chiang Mai University. The CMU EDUcast is a production of the Faculty of Education at Chiang Mai University. For more information, visit us at cmu.ac.th. I'm Chris Mangum. Thanks for joining us. We'll see you next time.